Hi there! Today we are going to be doing the Voo Breathing technique by Dr. Peter Levine. This breathing technique stimulates the vagus nerve, which in turn activates the parasympathetic nervous system, which brings you out of a fight, flight or freeze response system and brings you back into calm and rest and digest. If this means nothing to you, a quick breakdown is that there is a nerve that runs all the way from the brain down to the body. So it runs to the heart, to the lungs, to the digestive system and all throughout your body. It's called the vagus nerve. This is by far the biggest nerve in the body, and it sends information from the brain down to the body to the visceral and then back up again. So anything that you're feeling in your body will then be sent back up to your brain via the vagus nerve. Anything you're feeling in your brain will be sent down to your body. And it's kind of a loop. And so being able to control your vagus nerve or to help your vagus nerve will also help control your nervous system and bring you out of a fight, flight or freeze state, and it will bring you back into rest and digest, which is a more calming state. I do have some information on my phone here that I'm going to read out to you. We're then going to practice the Voo breathing 5 times together, and then I'm going to talk to you about how the Voo breathing can help people specifically who have been through infant loss. Dr. Peter Levine's Voo breathing technique is a powerful tool from the field of somatic experiencing, which focuses on healing trauma by addressing physical sensations in the body. Voo breathing is designed to help regulate the nervous system, especially when someone feels dysregulated or stuck in a state of flight, fight or freeze, common responses to trauma. The technique involves taking a deep breath in and then slowly exhale while making a deep resonant voo sound, like the sound of a foghorn or a deep hum. The sound is long and drawn out, creating vibrations in the body, especially around the chest and abdomen. These vibrations help release tension and reset the autonomic nervous system. A key aspect of the technique is extending the exhalation, which activates the parasympathetic nervous system, the part of the nervous system responsible for calming the body after stress. This is what helps a person move from a state of hyperarousal to a more relaxed state. By focusing on the vibration and sensation within the body, the Voo breathing technique helps individuals ground themselves in the present moment. This practice can make a person feel more connected to their body and better equipped to handle emotional or physical discomfort. Some of the benefits of the Voo breathing technique is that it helps to bring the body out of a fight or flight state and more into a relaxed and calm state. The vibrations caused by the Voo sound can help release trapped tension or energy in the body. It encourages a person to tune into bodily sensations, increasing awareness of emotional and physical stress. And lastly, it is particularly effective for managing stress and anxiety by promoting deep relaxation. So the instructions on how to do the Voo breathing, I'm going to run through it and then we'll do it together. So sit or lie down in a comfortable position. Take a slow, deep breath in through your nose. As you exhale, make a deep, resonant voo sound. Aim to sustain the sound for as long as you can comfortably manage. Feel the vibrations of the sound in your chest and body as you continue the exhale. After completing the exhale, pause for a moment and notice how your body feels. Repeat this process several times, noticing any shifts in tension or relaxation in your body. So now I'd like for us to run through it together. I'm going to do it 5 times, and then you can pause the video if you want to do extra times on your own. If this feels like too much for you right now, you can simply sit and listen to me doing it, and maybe that will help relax your nervous system. And if you do want to join in, feel free to do 1 or 2 or even the whole 5. But don't feel pressured, don't feel like you have to do all 5, you have to do it properly. Just do whatever feels good for you in the moment. So before we start the Voo breathing, let's take a moment just to check in with ourselves. So maybe noticing how your body feels at the moment. Noticing if you are in that fight, flight or freeze state. Checking in to see if you have any pain or tingles or sensations in your body. And to do a deep inhale through the nose and then exhale with a Voo sound. I'm going to do it 5 times, but like I said, feel free to do it as many times as you feel comfortable today. Return to your normal breathing. Oh my gosh, I instantly feel so chill. I could easily go and lay down and relax. I'm hoping you're feeling the same. So that was the Voo breathing technique. Feel free to click away if you have not experienced infant loss and you don't want to learn about that side of things and how the Voo breathing can help people experiencing infant loss. But if you do want to stick around for that, I have 10 ways in which the Voo breathing can help people experiencing infant loss. Voo breathing can be a highly beneficial tool for individuals who have experienced infant loss, as it directly stimulates the vagus nerve, which in turn activates the parasympathetic nervous system, which is responsible for the body's relaxation response. We've talked about this. This activation helps the body move from a heightened state of stress, grief, or trauma to a more calm and regulated state, providing relief from intense emotional pain. Here's how it can specifically support those who have experienced infant loss. Number 1, it relieves emotional and physical tension. Infant loss often brings immense emotional pain, leading to chronic stress, anxiety, and physical tension in the body. Voo breathing encourages deep, slow exhalations, which help to release physical tension that might be held in the chest, stomach, or shoulders. The deep vibrations from the Voo sound stimulate the vagus nerve, signaling the body to relax and let go of tightness. So let me know in the comment section down below if you noticed a release of tension in your shoulders and your chest, if you just feel that release of tension. Number 2, it regulates the nervous system. Grief and trauma can cause dysregulation in the nervous system, pushing the body into a state of fight or flight, or even freeze. Voo breathing helps by engaging the parasympathetic nervous system, calming the body's stress response and allowing the person to move out of a heightened state of emotional arousal, anxiety, or despair. For someone who is in constant emotional distress or experiencing panic attacks, Voo breathing can offer a sense of immediate relief by bringing the body back to a grounded, regulated state. Now, I wish I knew this when I had my first miscarriage and my abortion, because I think this would have really helped me out when I was in stressful situations. Maybe when I was going to therapy in the same hospital as where I had the abortion, maybe when I was seeing friends with babies, maybe when I was hearing babies crying, maybe when I was seeing pregnant people in the street. All of these different things really triggered me and really upset me, and I would have that gut feeling of like, oh my gosh, this is awful. I feel sick, I feel anxiety, I feel stressed, I feel grief. And having this Voo breathing in the bag as kind of a resource you can go back to and you can pull up whenever you need it. I think you can always find a quiet area, whether it's in the street, whether it's in your home, maybe it's at work, go to the toilet and practice Voo breathing. It really doesn't matter if you look stupid, if anyone hears you, if anyone notices, so long as it calms your nervous system and brings you back into a relaxed state. I think that is incredible. So I really hope that you bring this with you if you're ever struggling with grief after infant loss. So number 3, it provides a sense of control. After infant loss, parents may feel a profound sense of helplessness and lack of control. Voo breathing offers a tangible, simple practice that empowers individuals to have some control over their emotional state. Knowing that they have a tool that can help soothe their nervous system can be very reassuring, offering comfort in the midst of overwhelming grief. I think that is so true. After infant loss, you think, oh my gosh, why did this happen? What could I have done to help it or stop it? Or, you know, you feel this kind of, like it says, this helplessness or lack of control because it was out of your control that you lost this baby. And again, I think having this breathing technique that you are in control of, you can control your breathing, you can notice the sensations in your body, and you can calm your nervous system, I think is incredible. Number 4, creates a safe space to process grief. Grieving can be incredibly difficult, and many people may struggle to find a safe space to process their emotions. Voo breathing allows individuals to focus on their body and breath, providing a safe, grounded space to begin processing their grief without being consumed by it. The gentle sound and vibration serve as anchors, allowing them to stay present with their feelings while remaining calm and centered. So again, this is something, if you're having really big emotions, you can do the Voo breathing just to kind of bring your energy and bring your focus back to your body, back to your breath, and back to you, and to kind of escape the turmoil and the stress that might be going on in your brain that then sends the signals down to your body because of the vagus nerve. You can start to focus on your body in a more positive way, and again, it'll just help with your grief and your emotions. Number 5, reduces anxiety and panic symptoms. Those who have experienced infant loss often face heightened levels of anxiety, whether it's triggered by seeing pregnant people, hearing babies cry, or encountering reminders of their loss. Voo breathing helps reduce anxiety by slowing the heart rate and promoting a feeling of safety and relaxation in the body. This can be especially helpful during moments of anxiety or panic, as it helps to quickly bring the body back to a state of calm. So this is what I was saying about hearing babies crying, seeing pregnant people, seeing babies. Doing the Voo breathing can reduce anxiety and panic symptoms. Number 6, supports long-term healing. This one's important. Grieving after infant loss is a long and complicated process. Regularly practicing Voo breathing can help maintain emotional and physical regulation over time, supporting the individual through waves of grief, anger, or sadness. By integrating Voo breathing into their daily routine, individuals can create moments of peace and calm, even amid the ongoing process of healing from such a profound loss. So it's suggesting here that you can bring this into your daily routine. Maybe you do, 5 Voo breathing in the morning, 5 Voo breathing at lunchtime, and then 5 Voo breathing at night time or before bed. Like I said, it really helps me now to get to sleep. If I have a night where I have anxiety or I have insomnia or, my brain is just going a million miles an hour, I also have ADHD, I find that doing Voo breathing really brings me back into my body, and it's something that I'm going to start practicing more, I think, on a regular basis, because it is so easy and it's just something you can just do. You don't need a yoga mat, you don't need any props, you don't need somebody else to do it with you. You can literally just do it on your own, wherever you are. You can just start doing the Voo breathing. Number 7, mind-body connection in healing. Voo breathing helps individuals connect more deeply with their bodies, which can be especially important for those who feel disconnected or numb after loss. Grief often causes people to dissociate from their physical body as a way of coping with intense pain. Voo breathing encourages a gentle reconnection with bodily sensations, helping people regain a sense of presence and safety within themselves. And I think this is really important, being able to connect the mind and the body, because I remember after infant loss, throughout the day I could have maybe 10 different emotions. Half of the day I was numb. My body could not process what was going on, so I would just go numb and I would just not cry, not have any thoughts in my brain. It was almost as if I got switched off. And then when I got switched back on again, I would be crying, I would be angry, I'd be frustrated, I'd be jealous, I'd be like lots of different emotions, and then it just got all too much and I'd switch off onto numb again. I would switch over to numb and I would just be, okay, it was like my body could relax for that sort of however long it was in the numb state. But being numb obviously isn't great either. So when you're in that numb state, or when you feel disconnected from your body, or maybe upset about your body, I know that I also felt quite angry at my body for having a miscarriage. Like, why did you do this? What's wrong with you? Why aren't you working properly? I think doing something like Voo breathing can bring your connection back to your body and back to feeling the sensations within your body, the vibrations, and it can just connect the mind and body again. So I think, it's really, really important. Number 8, reduces hypervigilance and stress. After the trauma of losing an infant, many people may live in a state of hypervigilance, constantly anticipating something bad happening or experiencing heightened stress in everyday situations. Voo breathing, through its parasympathetic activation, helps reduce this hypervigilance and calms the overactive stress responses, creating a more balanced emotional state. Again, super important. Helps you stay calm and takes you out of the hypervigilant states. I think oftentimes when you go through something really stressful, you're then on the lookout for more stress and more things that could go wrong. Whereas then if you do something like the Voo breathing, you can come back down into a calmer state and not be on the constant alert and lookout for things that might happen. Number 9, helps navigate social triggers. For those who have experienced infant loss, certain social situations, such as seeing babies or interacting with other parents, can be extremely triggering. Yes, it can. Voo breathing can be a useful practice to employ before or after encountering these triggers, helping to manage the emotional overwhelm that can arise. It allows individuals to calm their nervous systems, reducing the likelihood of being thrown into the state of distress in these situations. This is such good advice. If you have been through infant loss and you know that you're going to see a friend who is pregnant, or you're going to a baby shower, or you're going to see a friend who's recently had a baby, maybe you're going to the mall and you know that you're going to see baby clothes shops or babies in prams, or maybe you are, going to work and you're a nurse and you're going to see lots of pregnant people, whatever it is, whatever the situation is, you can do the Voo breathing, 5 times, 10 times before you go into that situation. So before you go into that friend's house, practice some Voo breathing in the car. Go into the friend's house. If you need to step out for 5 minutes and do some more Voo breathing, that's absolutely okay. If they're a friend, they'll understand. Go back in again, spend time with them, and then when you're finished, you can do the Voo breathing again, just to kind of cleanse yourself and to bring you back down into a state of calm. I remember there was a day, I think it was maybe 3 months after the abortion, something like that. We went to see some friends and she had just had a baby at the same time as when I was due. I think she was due a couple of weeks before or after, I can't remember now. But we went to go and see her. We were with a friend. We went on a day trip, went to see something in France, and then we went to go and see her afterwards. And it was meant to be just a little pop in and see the baby. And I remember as soon as I knew we were doing that in the car, I just felt so sick. I had crazy anxiety. My stomach was just in pain. Like I felt physical pain from just the anxiety and the stress of seeing this baby. We pulled up, I couldn't get out of the car. I felt so rude. I felt like I had to be there. I had to go into the house. And it really took me maybe 20 minutes to get to the front door. I was just in fits, like crying my eyes out, so traumatized, so upset, so just, it was honestly awful. It was so scary, and it was so like sad that I couldn't be there and see this child. And I couldn't even look at him. I eventually got in the room, into the house. He was in a cot, and I was just crying and crying. And I think sometimes when you get into that state, like I said before, you know, your brain sends signals down to your body and your body sends it back up again to your brain. It can be a really vicious cycle where you just get worse and worse and like deeper and deeper in your anxiety and in your stress and in your like overwhelm almost. And I think having something like this is so crucial, because I could have done the Voo breathing in the car. I could have done the Voo breathing outside. I could have done the Voo breathing in the room with all of them, maybe invite them all to do it with me. It's one of those things where like I don't know what would have happened, because I can't obviously go back 7 years and do it again. But I wish I had this information at the time, so that's why I'm sharing it with you. So if you ever feel like you're going to be going into a situation that might be stressful, it might be hard, do some Voo breathing or find something else that works if this doesn't work for you. But try and find some sort of practices that you can do that can help you with these situations. And then number 10 is encourages a sense of inner peace. While the pain of infant loss may never fully go away, Voo breathing offers a practice that fosters moments of calm and peace amid the turmoil. The soothing vibrations and deep breathing activate a sense of inner stillness, allowing individuals to access peace, if only for brief periods. This can be a deeply healing practice for those navigating the waves of grief, providing moments of relief and rest. So like it says there, it offers that inner peace and that inner stillness. Check in with your body, do some breathing, and then check in with your body again and notice how you feel, if you feel any different, if you feel any sensations have subsided, if you feel less of that kind of gut-wrenching feeling. So the affirmation for the week is, with each breath, I release tension and bring calm into my body. I allow my breath to guide me towards healing and peace. And the book recommendation is In an Unspoken Voice, How the Body Releases Trauma and Restores Goodness by Dr. Peter Levine, who is the person who did the Voo breathing technique. This book explores the mind-body connection, trauma release, and how somatic experiences such as breathwork can help in the healing process. It's a great resource for understanding how practices like Voo breathing and other body-focused approaches can support trauma recovery. So I really hope you enjoyed this video. Thank you so much for watching. I hope you find it useful, and I hope you can use the Voo breathing anytime you need it. It doesn't matter where you are, who can hear you or who can see you. You can really use this to your advantage to calm your nervous system and to bring you back into a state of peace. If you're going through infant loss, of course, I'm sending you so much love. I promise you can get through this. You can find more information on my website, healingafterinfantloss.com. If you want to look at blog posts, other book recommendations, there's stories on there. There's lots and lots of information. So you can go ahead and look on there. You can also follow me on TikTok and Instagram, and then also subscribe to my YouTube channel, where I'm going to be sharing more information and more healing practices, such as the Voo breathing. Thank you so much. Have a wonderful day. Bye.